The Gait Guys. Case in 1 minute. Today's case is about this guy. This guy has lower back pain. The question is, why does he have lower back pain? He was standing up, lifting a box. The box weighed approximately 20 pounds. He had his weight on his left leg, and he was rotating from right to left. Can you see anything wrong which may have caused his back pain or why? Let's take a closer look. In these two shots, he's lying supine, and I have fully internally rotated his leg on each side. What do you see? Can you see that he has limitation of internal rotation at each hip? Can you see how he doesn't have the requisite 4 to 6 degrees of internal rotation needed? Do you also notice that he has internal tibial torsion on each side? When we drop a plumb line from his tibial tuberosity downward, we see that his foot is medial on each side. We often see this combination of internal tibial torsion along with loss of internal rotation of the hip due to femoral retrotorsion. Femoral retrotorsion is when the hip has a femoral head angle of less than 8 degrees. Let's take a look. The normal angle between the femoral condyles and the neck of the femur should be somewhere greater than 12 degrees. When this is less than 12 degrees, we say that the hip is retroverted. Retroverted hips cause internal rotation of the foot. Therefore, we externally rotate the foot to be able to progress forward normally. Antitorted hips are the opposite. This is where the angle here is much larger. So as a result, we toe in to create the range of motion that we need. As we can see in the picture on the right, people with femoral retrotorsion have a femoral head angle less than 8 degrees. Therefore, to create the range of motion needed to be able to progress forward normally, they have a tendency to rotate their foot to the outside. In this particular case, here, when the foot is in the normal position, we have a limited amount of internal rotation of the hip. You'll notice that our gentleman here externally rotates to create the range of motion needed for him to be able to internally rotate the requisite 4 to 6 degrees during the gait cycle. When he's in a standing position and his foot is straight, he has no internal rotation available to him at the hip. He already has internal tibial torsion, so he cannot rotate in 4 to 6 degrees. He rotates in 0 degrees. Where does the motion have to occur? The motion has to occur in his lumbar spine, which only has an average amount of rotation from L1 to L5 unilaterally of 5 degrees. When we load the lower extremity and we move from right to left, we force the left hip to try to go through a range of motion that it doesn't have. That motion then will occur at the lumbar spine. This results in lower back pain, which he had. So, he was treated with manipulation. Attempts were made to try to improve the amount of internal rotation of his hips, and he was told to spin his foot outward when planting that foot and putting weight on it and rotating from right to left. Thanks for joining us on The Gait Guys. Case in 1 minute.